Dylan, can you also record?
Yeah, I can do that too, yeah.
Okay. Shall we start? Do we have time? Right. 1 more minute.
Sharp, right? Yeah, still we have time, right?
So may I screen එක අඩු අයින් කරන්න මට ඔක්කොම ටික කොච්චර බලන්න පුළුවන් ඒකට තව නැත්නම්
yeah.
It's the host.
We have 22 participants right now. We can go from start. Yeah.
So I want to later introduce, some norms, but immediately keep your mic muted to avoid disturbances. But I encourage to keep the videos on so that people know you by face. Okay. Vitura Tenokon joined from the United States. Admit. I think people will join even after 2 hours.
And we can see Dr. Chamal also has joined now.
Okay.
Yeah.
So that's Sanjeev.
Yeah. Yes, sir.
Keep your, as far as possible, keep the videos on. Right. All right. So let's. Can I start, Ilan?
Yeah. Yeah.
Yeah. So welcome to the Global Solidarity Forum on COVID-19. So it's pleasurable and happy evening for me here from Colombo because it's a good consortium of professionals from different countries who are interested in this global pandemic, mainly based on the issues we have in Sri Lanka and elsewhere. I'm very happy to see some of the colleagues who are known to me for many years, and also new guys and some kind of celebrities also on the issue. So thank you very much for joining. The idea today is actually to have this session. My name is Chaminda Hettiarachchi. I'm let's say I'm a social activist and researcher working on different issues, mainly on social issues, political issues. I'm not actually, of course, not a medical person, but I'm looking this pandemic from mathematical, scientific, and social point of view. So the idea or the objectives of this session is to actually create a forum for, let's say, not necessarily hardcore experts only, even though we have professionals with different expertise, but there is a convention and belief that the pandemic should be managed only by professional medical people who are in the government or in the official things. But we have been kind of looking at the concept of crowd wisdom or wisdom of the crowd, because as I've been kind of observing, there are a lot of new ideas coming from people from different backgrounds with different disciplines, not just on medical sciences or epidemiology, whatever it is. So we want to create a platform for everybody who want to contribute, maybe with their personal experience, any best practices known to them, or from their own countries or own regions, or even the mistakes made or some kind of blunders in their own personal level, national level, or even a global level. In addition to that, you can also share your ideas on policy level, what kind of policies or action should be taken by national or regional or even individuals, governments or individuals or communities. So we look at all these options. So in addition to being a platform, we want to discuss this as a broad forum or gathering of people where we can create our own communities. I don't know, maybe digital communities, WhatsApp groups, or any other groups for the additional work in the future. And you are free to have your own communities. We will also try to have something common one. But I know this, now here, if you look at the groups here, for example, I don't know for all of you, but we are connected to each other some other way. So I think we can also create a forum because, as I mentioned to you already, we need new knowledge, new thinking, new expertise to manage this, let's say, challenge to humanity. As WHO has said, which I have already quoted here, nobody is safe until everybody is. And also, global solidarity is a key in managing these kind of issues, which, let's say, we can say this is like the most, let's say, most powerful or challenging threat to the humanity after WW2 or World War II. So therefore, there are no fixed solutions. We have to find out everything by trial and error and by the knowledge or expertise of all the people. So you are free to share your ideas. You don't have to worry about even language. You can speak in English, preferably, because then everybody will understand. But also you can also speak in Sinhala or Tamil or German or any other language you think comfortable. Of course, you will lose some audiences, but it's still all right. This will be recorded and then shared for the public viewing later, and we will be able to reach more people through that. And also, I want to, I mean, normally when we do this kind of forum, indirect, idea is to influence the policy makers that people as citizens gather together to discuss beyond their, let's say, traditional forums or traditional media or in official forums, so that we want to tell them that we also have expertise, some kind of power to take actions and even protest. Today is no more much about protest, but we can even do protest. Idea is that we have to show the power of citizens or people, not in the mainstream or not in the policy, but among in the communities. Now, in terms of areas of discussions, as I already mentioned, this is not focused just on, let's say, COVID as a public health issue. Of course, it's a public health issue, but we have a lot of discussion on that in the media or in the government level. But it's all right. We can also talk about social issues like social distancing, health practices, public policy, measures, vaccination. So you are free to explain or discuss any of those measures or ideas, considering COVID-19 as a public health challenge, but also this is a social issue. For example, how you kind of develop new norms, what are the limitations or restrictions or opportunities we have, and how you consider this as a social, challenge to humanity, how we can go to the next level, how to, for example, build societies, communities beyond what we have now, how to build better. And then this as a COVID as a political challenge, because you can see the countries, the political leadership have been challenged. A lot of countries are struggling, and also the understanding of what is good political leadership and what is not good leadership are also discussed. For example, in countries like Sri Lanka, the debate on whether politicians or political leadership are trying to help really the need of the people. So, and also under this, we can also talk about vaccine nationalism, how vaccine, for example, as a public good has created different, let's say, divides, haves and have-nots, how this vaccine distribution and execution in the country, inside the countries have created tensions. So those kind of issues we can discuss. And also finally, economical challenge. Now, COVID is also affecting everybody's lives, and as a result of that, what will be the implications on other future, for example, livelihood and our jobs. So those are such kind of areas beyond political, economic, political, social, and health issues. This is also a great economical challenge. People, all of you can think about them and share your ideas. Now, a final point I want to, before going to the next level, I want to also very quickly discuss about what I have been doing. For example, I have been paying attention and learning about COVID-19 from, let's say, March 2000, not actually even before March. I first heard about this in January 2020, and from that day onward, I have been studying this. For example, what can I do in terms of my expertise in project management, strategic management, and technological management? So the importance of modeling, predictions, use of science, for example, mathematics, and non-medical sciences. So I have been writing posts and holding some, video discussions. And actually encouraging people, because there is a kind of popular myth that only doctors should talk about this pandemic. And for example, when I invited some people to join this discussion, they said, let the experts to handle and we will just follow their advice. I think it's a wrong approach. We all, as first of all, as affected people, and also as people who have expertise in some other fields, maybe from computer science to mathematics, medicine, public health, philosophy, sociology, regardless of the background you have, you can contribute. And I have been also trying to encourage that kind of approach beyond just doctor-focused approach, which is very dominant in countries like Sri Lanka. I'm sure you have different experiences. And also, yeah, so I think most important thing is not knowing the solution, but understanding the problem, sharing everybody's concerns, identifying their problems, and even let's say crying together, or being empathetic towards other people and their concerns. Also, it's important. So I have been trying to do that also. I will not go into details, but I'm sure I can share with you some of my work I have done. And also, this is also some idea for you, some of you. I have already started mainstreaming COVID-19 for my, for example, teaching. For example, I teach mainly management subjects using Harvard Business School's case method. And Harvard has already produced several cases on COVID-19 as a global pandemic. And then there's another case on Gavi, that is how to manage the vaccine globally. So I have already introduced them to my classes. We regularly discuss them mainly among MBA students. And also my main work is adapting industry for technologies in Sri Lanka. So according to my thinking and assessment, COVID-19, with all the pains it has given to us, it is also kind of a trigger for introducing industry for technologies, and it's kind of short-circuiting the requirement. As you can see, we started doing this Zoom in 2017, Google Hangout in 2014. Those days, it was very difficult to have people in a global online forum, but now it is like everybody's, day-to-day work. So therefore, there are a lot of opportunities for digital technologies to reach you wherever you are in your daily life. So that is my work. So I'm trying to use what is the impact of COVID-19 to industry for adaptation in countries, particularly developing countries in Sri Lanka. But now that's what I have been doing. So I'm very much interested, we as a group, how we can look at everybody's experience and how we can work together as a, even the loose group, a community, to overcome and get out of this big challenge. So that's all I have to say. So you are free to have your own kind of discussion. Very quickly, again, about the norms. I have written down some kind of norms of our discussion. As I already mentioned, you can, like, for example, when you start the discussion, you can talk for like maximum 5 minutes during your first cycle, but then we can also have discussion at the end. We can go, maybe I have fixed this for 2 hours, but we can go up to maximum 4 hours depending upon the interest. And keep always your video on as far as possible, and keep the mic muted to avoid this, disturbances. We'll have a separate Q&A session. Also, in the meantime, you can also use chat function to talk to everybody. I think it's also enabled to have discussions. Let me check. I will check it a little bit later, but we can also do the discussion, simultaneous discussion in chat function. You can share documents or files or whatever it is there, your contact number. So we will normally do this through like first in, first out. FIFO system. People who join first will get the chance to speak first. So please try to keep into your queue. But if you have some urgent issues, you can raise hand or you can ask other people to speak earlier. Yeah. So if I forgot something, Nilan, my co-host, can do it. Nilan, you can start your idea sharing, and if you have any other things to tell the audience or the participant, that will be very useful.